Hello, my name is Agnieszka Beckett, and today I am going to explain how the article Early Intervention for Autism with a Parent-Delivered Qigong Massage Program, a randomized controlled trial, contributes to the development of the OT profession. The assigned article contributes to the development of the OT profession in many ways. The rising incidence of autism, in conjunction with growing public awareness and progress in early diagnosis, has resulted in many more children being identified in the preschool period and referred for early intervention than in the past. This scenario sets up a window of opportunity for early intervention programs to remediate the social and language delays that are common characteristics of autism to better prepare children for primary school. There are several early intervention approaches out there that had their varying degrees of success and drawbacks, from high cost to unavailability of service. The QST treatment method indicated in this article is a manual therapy based on the principles of Chinese medicine. This treatment method consisted of protocol of 12 intentional patting, shaking, and pressing movements applied to 12 areas of body while recipients are clothed. The QST treatment method was given to preschool children for a period of 5 months. The results showed how preschool children with autism displayed significant improvement in behavioral, social, and language measures of autism, and even improvement in sensory impairment and self-regulation. This treatment method, like any other treatment method, would require special training. Occupational therapists will have to demonstrate competency in order to deliver the treatment successfully. Also, there would be a governing body that would oversee certification. If a therapist is certified, he or she will be able to give the treatment to his or her clients. This article shows us as never treatment methods are discovered and delivered, there will be a need for occupational therapists far and wide to further expand their knowledge and expertise and successfully complete training so that they may better serve their clients' needs.
Hello, my name is Courtney Henry, and today I'm here to discuss the quality of evidence presented in this article. The quality of evidence presented in this article is moderate, displaying a qualitative research design. A randomized trial was used when conducting the intervention. The sample size was small, only having 24 children in the intervention group and 18 children in the control group. The improvements of the children were observed in 2 different settings. The article briefly mentioned drawbacks of the treatment, which includes the high cost and unavailability of service. Also mentioned is the required training for therapists and the required training for parents who want to administer the treatment. The article did reference other evidence-based articles which showed to have similar findings to their results. However, not enough research has been done to make an evidence-based decision on whether or not the implementation of this treatment approach would be useful.
So the first step would be to look at the population. In this case, it would be with preschool children less than 6 years old who are diagnosed with autism. Since a child's main occupation is playing and learning, the intervention would be focused on getting the body and senses ready to engage in occupation. I would then use this article along with other evidence-based articles or interventions related to the topic of sensory integration and self-regulation to back up the effectiveness of the proposed intervention. So for children with autism who present with sensory impairments, occupational therapists may apply tactile or deep pressure input, such as rolling a therapy ball over the body or wrapping them tightly in a blanket. Therapeutic massage, such as the Qigong massage described in the article, will be used as an adjunct therapy to relax the child and prepare them for the functional activity. So when working with the supervising OT, the OTA would customize the massage according to the child's needs and response to the tactile stimulation. Both the OT and the OTA will need to be trained and certified in providing the skilled Qigong massage. And again, the aim of the massage is to provide relaxation and help with body awareness in order for the child to be more attentive and demonstrate socially appropriate behavior during the remainder of the session. Parents can also be educated and trained to use the massage techniques to reinforce the tactile stimulation when the children are at home. This can also help parents become closer to their child, as parents with children with autism have expressed a lack of affection and love from their child due to decreased social, tactile, and body awareness. And throughout the intervention, the OT and OTA would assess the child's self-regulation and sensory processing to see if there have been improvements, and they would adjust treatment accordingly.
Hello everyone, my name is Tanya, and today I will be describing how the evidence-based process is used to evaluate OT service delivery and professional issues. The evidence-based process is used to evaluate OT service delivery and professional issues by providing studied and proven data that allows occupational therapists to implement new therapy services to clients who may benefit from various studies conducted. Occupational therapy is not as well known as physical therapy to the average person, and many of the services provided may seem useless to most people who don't understand the benefit occupational therapy could have to a patient's health and well-being. By conducting case studies, we advocate for occupational therapy through evidence-based practice and show clients, families, insurance companies, and others that occupational therapy is an essential therapy service to the recovery well-being of an ailing client. Evidence-based practice promotes occupational therapy as a legitimate and effective service to all who need it, and with evidence, facts, statistics, and data, it shows that the benefit it has on the health and well-being and the recovery of patients with various diagnoses.